If you're over 60 and taking metformin for your blood sugar, there's a risk that almost nobody talks about, and it has nothing to do with your glucose numbers. It's about a vitamin that can quietly run low over the years, so slowly that you might blame every symptom on simply getting older. By the end of this video, you'll know exactly what to ask your doctor, what symptoms deserve a second look, and one gentle daily habit that supports your nerves as you age. Stay with me. The last point ties everything together. A few things change in your body after 60 that make this worth paying attention to. First, your ability to absorb certain nutrients from food naturally declines with age. Your stomach produces less acid, and that acid helps release vitamin B12 from the protein in your food. So even before metformin enters the picture, your body is already working a little harder to pull B12 from what you eat. Second, your nerve cells become more vulnerable over time. The protective coating around your nerves, called the myelin sheath, tends to thin naturally with age. B12 is one of the nutrients your body uses to help maintain that coating. When B12 runs low, some people notice tingling, numbness, or balance changes. Third, metformin is one of the most widely prescribed medications in the world for type 2 diabetes, and it's often the first medication doctors recommend. It has helped millions of people manage their blood sugar. At the same time, a number of studies over the years have found an association between long-term metformin use and gradually lower B12 levels in some people. Health regulators, including the UK's Medicines and Healthcare Products Regulatory Agency, have noted that this is more common than once thought. That doesn't mean metformin is unsafe or that you should stop taking it. It means this is worth knowing about, so you can bring it up at your next appointment. If you've been taking metformin for more than 2 years, type yes in the comments. If less than 2 years, type no. It helps me understand who's watching, and it's a good moment to pause and think about your own timeline. Imagine a 68-year-old woman named Margaret. She's been on metformin for about 6 years. Her blood sugar has been well controlled, and her doctor is happy with her progress. Lately, though, she's noticed her feet tingle a little at night. She assumes it's poor circulation, or maybe just part of having diabetes. It seems minor, so she doesn't mention it at her appointments. What Margaret doesn't realize is that the body stores several years' worth of B12, mostly in the liver. Research suggests it can take several years of metformin use before those stores run low enough to cause noticeable symptoms. A long-running study followed metformin users for over a decade and found that a meaningful portion of long-term users developed low or borderline low B12 levels. With that share continuing to rise the longer people stayed on the medication. The takeaway isn't that this happens to everyone. It doesn't. The takeaway is that it can build quietly without symptoms for a long time. Feeling fine today doesn't rule out feeling low on B12 underneath. If you've been on metformin for more than a couple of years, ask your doctor whether a B12 check should be part of your regular blood work. It's a simple, inexpensive test, and having a baseline number gives you and your doctor something to compare against later. Imagine a 72-year-old man named Robert. His doctor increased his metformin dose last year because his morning blood sugar readings were creeping up. His glucose numbers improved, and everyone was pleased with the result. What Robert didn't know is that research has generally found higher metformin doses, taken over a longer period, are associated with a greater likelihood of low B12 DARS, compared with lower doses taken for a shorter time. This is why regulators note that risk tends to rise with both higher dose and longer duration of treatment. Every additional year on the medication appears to nudge the odds up somewhat, according to long-term follow-up data. This doesn't mean a higher dose is doing something wrong. For many people, it's exactly the right call for controlling blood sugar. It just means the trade-off is worth tracking. Never adjust your own dose without your doctor's guidance. Instead, if your dose has gone up, mention that specifically when discussing blood work and ask how often B12 monitoring makes sense for your situation. Imagine a 65-year-old man named Frank. He's been on metformin for 7 years. About a year ago, he started noticing pins and needles in his toes. He mentioned it to his doctor, who attributed it to his diabetes. Frank accepted that explanation. After all, he'd heard diabetes can cause nerve damage. Here's the complication. The symptoms of B12 deficiency and diabetic nerve damage overlap heavily. Tingling, numbness, reduced sensation, and balance trouble can show up in either condition. When a doctor hears tingling in the feet from a patient with diabetes, it's easy and often reasonable to assume it's the diabetes. But it isn't always. Some research has found that among people with confirmed metformin-related B12 deficiency, tingling, reduced reflexes, and balance issues are common features. That doesn't mean every case of tingling is B12 related. Most tingling in people with diabetes probably is related to their diabetes, but it does mean it's worth checking since the two causes are treated very differently, and one of them may be reversible. If you develop new tingling, numbness, or balance changes and you're on metformin, ask your doctor directly, could this be related to B12 and should we test for it? It's a simple question that could meaningfully change the direction of your care. Imagine a 70-year-old woman named Patricia. For months, her tongue has felt sore and looked unusually red. She's had mouth ulcers come and go. She switched toothpaste, tried a new mouthwash, and figured it was just part of getting older. It never crossed her mind that it might connect to her metformin. Health regulators specifically list a swollen, sore, inflamed tongue, along with mouth ulcers, as recognized signs of low B12. Some research has also pointed to a burning sensation on the tongue, changes in taste, and cracking at the corners of the mouth as possible related symptoms. The reason the mouth shows changes early is that the cells lining it divide and renew quickly, and B12 plays a role in that process. So changes here can sometimes appear before other, more obvious signs. If tongue soreness or mouth ulcers persist for more than a couple of weeks without an obvious cause, mention it to your doctor, not just your dentist, and ask whether it's worth checking your B12 alongside it. Imagine a 74-year-old man named Walter. Over the past year, he's become noticeably more forgetful, misplacing his keys, walking into a room, and forgetting why. His family has started quietly wondering about dementia, and his doctor has raised the idea of cognitive screening. Walter is frightened. He's watched friends decline with Alzheimer's, and he's afraid he might be next. Walter has also been on metformin for 9 years, and no one has ever checked his B12. Some studies have found an association between long-term metformin use, lower B12 levels, and a somewhat higher risk of cognitive difficulties. Separately, B12 deficiency on its own has been linked in research to memory problems, confusion, low mood, and, in more severe, longer-standing cases, symptoms that can resemble early dementia. Some clinical literature specifically notes that in older adults, B12 deficiency can be easy to miss because its symptoms get attributed to just getting older or to other existing conditions. This is an important point to get right. Most memory changes in older adults are not caused by B12 deficiency, and this video is not suggesting that dementia is usually secretly a vitamin problem. What it is suggesting is that B12 is one of the few genuinely reversible causes of memory and cognitive symptoms, so it's worth ruling out before jumping to more serious conclusions, especially in someone on long-term metformin who has never had it checked. If you or a family member notices memory changes, ask your doctor whether a B12 test has ever been done, and if not, whether it makes sense to check it as part of the overall picture. Imagine a 63-year-old woman named Dorothy. She's felt unusually tired for months, the kind of tiredness a nap doesn't fix. She's also noticed she's a little short of breath climbing stairs she used to manage easily. She's been blaming it on her age and her busy schedule. B12 deficiency doesn't only affect nerves. It can also affect red blood cell production, sometimes leading to a type of anemia. Symptoms of this can include persistent fatigue, paleness, shortness of breath with mild activity, and a fast heartbeat. Because these symptoms are common to many conditions, they're easy to attribute to something else: low iron, thyroid issues, or simply aging. Persistent, unexplained fatigue is always worth mentioning to your doctor regardless of the cause. If you're on metformin long-term, it's reasonable to ask whether B12 should be part of that workup. If you're finding this useful, consider subscribing. It helps this kind of careful, research-based content reach more people who might need it. Now let's get into how doctors actually diagnose and treat this, and the one research thread that ties the whole picture together. If your doctor suspects low B12, diagnosis usually starts with a simple blood test measuring B12 levels, sometimes alongside related markers that can catch borderline cases the basic test might miss. If levels are found to be low, treatment is generally straightforward and effective, typically an oral supplement or, in some cases, injections, depending on how low the levels are and how well the body is absorbing B12 through the gut. Your doctor will determine the right form and amount based on your individual blood work, kidney function, and other medications. This is not something to decide on your own or copy from a video. The encouraging news is that in many cases, especially when caught before nerve damage becomes long-standing, correcting a B12 deficiency can meaningfully improve symptoms like tingling, fatigue, and even some cognitive complaints. Imagine a 67-year-old woman named Linda. She's been on metformin for 5 years. Her doctor finally checked her B12 and it came back low. She started taking a supplement as instructed, but her follow-up numbers barely improved. She wondered if the supplement simply wasn't working. Here's an area of research that may explain cases like Linda's, though it's worth understanding its limits. B12 absorption in the gut depends on a protein called intrinsic factor, made in the stomach, which carries B12 to the lower small intestine, where it attaches to specific receptors. That attachment process appears to depend on calcium being available at the right place. Some researchers believe metformin may interfere with this calcium-dependent step, which could partly explain why B12 absorption drops in some long-term users. A small, older study, and some more recent follow-up research, found that adding calcium alongside B12 supplementation appeared to improve absorption in some metformin users whose B12 wasn't responding well to supplementation alone. This is a genuinely interesting research thread, but it's important to be honest about what it is: a promising area of study, not an established universal treatment protocol. It hasn't been tested at large scale, and it isn't standard practice everywhere. If you've been taking a B12 supplement as directed and your levels still aren't improving, that's worth flagging to your doctor specifically. Mention that you've heard calcium intake might play a role in absorption, and ask whether it's relevant in your case. This is a conversation to have with your doctor, not a substitution for their guidance. This last point isn't about a pill or a supplement, it's about movement, and it's something anyone can do regardless of mobility level. Nerve health and circulation are connected. Tissues that get consistent blood flow tend to function better over time. In general, one simple, low-impact movement worth building into your day is ankle pumping. Lifting your toes toward the ceiling, then pointing them down, repeated 15 to 20 times, a few times a day. This activates the calf muscles, which help push blood back up from the legs toward the heart. To be clear about what this is and isn't, this is a general, gentle circulation habit that supports overall leg and lower body well-being. It is not a scientifically established fix for B12 deficiency, and it doesn't replace medical treatment if your B12 is actually low. Think of it as a healthy habit that complements medical care, not a substitute for it. If you have limited mobility, this can be done fully seated. If standing is comfortable, gentle calf raises while holding onto a wall or sturdy chair are another good option. The goal is consistency, not intensity. As always, check with your doctor before starting any new exercise routine, especially if you have circulation issues, heart conditions, or balance concerns. Alongside anything your doctor recommends, B12 is naturally found in animal-based foods, fish, meat, eggs, and dairy, and is added to many fortified foods like some plant milks and breakfast cereals for people who eat little or no animal products. If you follow a mostly plant-based diet, this is worth mentioning to your doctor as an additional factor, separate from the metformin question. A few quick questions people often ask. Should I just stop taking metformin to be safe? No. Please don't stop or change your dose on your own. Metformin is protecting you from the effects of high blood sugar, which carries its own serious risks. The goal here is monitoring, not avoidance. Should I start taking a B12 supplement just in case, without a test? It's best to test first if possible. Knowing your actual level helps your doctor choose the right approach, rather than guessing. Is this deficiency common or rare? It's not universal, but it isn't rare either, especially in people on metformin for many years. That's exactly why regular monitoring is recommended rather than assumed to be unnecessary. Some symptoms should never be managed at home or written off as probably just B12. If you experience sudden numbness or weakness on one side of the body, sudden confusion, trouble speaking, facial drooping, or a rapid loss of balance, these can be signs of a stroke. Call emergency services immediately. Sudden severe chest pain, shortness of breath, or one-sided leg swelling with warmth also warrant immediate emergency care. These are not situations for home remedies or waiting to see if it passes. Let's bring it all together. B12 deficiency from metformin tends to build slowly, often over several years, worth checking if you've been on it a while. Higher doses and longer treatment duration are both associated with somewhat greater risk. Tingling and numbness are sometimes misattributed to diabetes alone when B12 deserves a look too. Mouth and tongue changes can be an early, often overlooked sign. Memory and cognitive changes are usually not caused by B12, but it's one of the few reversible causes worth ruling out. Persistent fatigue can also be a sign separate from nerve symptoms. Diagnosis is a simple blood test, and treatment is usually straightforward once identified. Calcium's role in absorption is a promising but still limited area of research, not an established fix. And gentle daily movement supports general circulation, a healthy habit, not a treatment. None of this is meant to create fear. Metformin has helped millions of people manage their blood sugar and live longer, healthier lives, and stopping it isn't the message here. The message is simple: know what to watch for, know what to ask your doctor, and stay proactive about the small things that protect your nerves, your memory, and your independence as the years go on. What's one thing from this video you'll bring up at your next doctor's visit? Let me know in the comments. This video is intended for general educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. Always talk to a qualified healthcare professional before making any changes to your medication, supplements, diet, or exercise routine. So, especially if you have kidney disease, heart disease, diabetes, or take other prescription medications. Never stop or adjust a prescribed medication based on information from this video.